You're watching Reality Check. India is at an inflection point with the coronavirus. The cases, despite one of the harshest lockdowns in the world, are surging, pushing India higher and higher up the global coronavirus charts. But there is a paradox here, and that's what my colleague Mariam Alavi and I are going to examine tonight on Reality Check. That as the cases continue to surge, the number of deaths, the most fatal and the most deadly manifestation of the coronavirus, deaths, remains low. So that's the India paradox that we're calling, and we will take a close look at that tonight. But let's first look at why, on the face of it, there is cause for concern. And that is because, as we said, India has now climbed up higher and higher on the global infection chart. So at the moment, India is number 10. It's reached the 10th rank as far as the number of cases are concerned. America is at the top with 16.7 lakh cases, followed by Brazil, Russia, UK, Spain, Italy, France, Germany, Turkey, and India at 1.5 lakh cases. If you look at our next slide, which looks at the number of daily cases, India has crossed even higher. India is now at number 4 if you look at the number of daily cases. So the USA is at the highest with 20,600 cases a day reporting. Brazil next at 15,800, Russia 8,600. India is at 7,000. This is of course figures as of May 25th. They will keep getting changed. But at the same time, remember that India is still testing very, very low. India claims that their testing has gone up, and that's why the number of cases has gone up. And it's true, India is testing over 1 lakh cases a day, which is much more than it was earlier. But it's still very low compared to how much it is testing to the rest of the world. And Mariam, this is the whole point, that if India actually started testing compared to some of these other countries, the number of infections would be even higher.
Yes, Vasu. So we are already at number 10, and this is despite low testing. If we look at the other countries in the top 10, Russia testing about 61,300 tests per million. Italy doing about 57,600 tests per million. UK 52,000, USA 43,000, Turkey around 22,000. And India is trailing far behind all these countries with just about 2,198 tests per million population.
Right. So that's the first thing. India is still testing low, and yet the infections are high. The other thing to note, and this is something that India should be concerned about, is that even though it's testing higher and higher, the growth of infections is outpacing the growth in tests. The average number of daily tests, and this is, we've compared, Mariam, between April 23rd and 29th, when we started with getting reliable data on testing, to May 19th to 25th, the average daily tests were going up by about 137%, but the average daily cases was almost double, Mariam.
Yes, Vasu. So while India can argue that we're testing more now, like you rightly mentioned, we're doing about 1 lakh tests every day on average, but that is still not enough to keep up with the number of cases that we have. Average tests, daily tests have increased by about more than doubled from about 44,000 to over 1 lakh tests now. This is between when we compare the week of April 23rd to 29 with the week of May 19th to 25th. But cases have almost increased by 4 times, by 277%, from 1,617 to over 6,000 cases on average every day.
Right. And what is further complicating the whole question of testing is, of course, the fact that all the states are testing differently. And worryingly, hotspot states like Gujarat and Maharashtra are actually testing, if you're looking at tests per million, lower than some of these other states, Mariam.
Yes, Vasu. So Gujarat and Maharashtra are doing between 3,000 to 3,500 tests per million. Whereas a state like, if we compare it to a state like Andhra Pradesh, which has far fewer cases. They are doing about 6,500 tests per million. So it does raise the question of whether some of these hotspot states should be testing more.
Right. Which is why some experts are saying, some people are saying, don't look at testing because testing is unreliable. The parameters keep changing. Sometimes you're testing more, you're testing less. States are distinct at different levels. Look at deaths because ultimately what matters is that you could get hundreds of people infected, but what you really need to control are deaths. And in that front, India, if you look at the graph, is perhaps not doing as badly as other countries. And this graph is plotting deaths now virtually for the entire month of April and May, Mariam, and this is tracking it in terms of the number of daily COVID deaths. And it's going up, but it's still not a kind of explosive growth.
Yes, Vasu. So daily deaths, if we look at from April to May, it's April to now, we were recording about 6 deaths every day in the beginning of April, 6 to 10 deaths. And now we are hovering at about 150 deaths per day. So even though that's a huge jump,
Right.
I agree, but then 150 deaths still, I mean, it's not an explosive increase like you said.
Okay, which brings us to actually perhaps a more reliable metric of measuring the death rate. And this is something now the government is also increasingly citing in its defense, even as the infections continue to surge, which is, of course, deaths per million. And if you look at it in terms of deaths per million, Mariam, India is right at the bottom of a host of countries.
Yes, Vasu. So while India ranked 10th in number of infections, when it comes to deaths per million, we are at the 131st rank, with trailing far behind countries like Italy, which is at the 4th rank with 542 deaths per million of their population. UK, again, 542 deaths per million of their population. France, 435. USA at the 11th rank with 295. Germany, 99 deaths per million. India at 131st rank with only 2.9 deaths per million of their population.
Right. And also what's happening is the doubling rate. This is something that's increasingly being used as a metric of measuring the growth of the virus at how fast it doubles. So the doubling rate of deaths is actually slowing down. So it started off from the time when we have reliable data, it was doubling every 4 to 5 days. Now the deaths are doubling almost every 15 days or 2 weeks, Mariam.
Yes, Vasu. So initially, if we look at the March 13th to 19th, the cases doubled in 6 days. March 19th to April 4th, the cases doubled about every 4 days. It slowed down further to doubling every 5 days between April 4th and April 13th. Then April 13th to April 24th, it doubled in 10 days. April 24th to May 5th in 11 days. And now we are doubling at 15 days. In fact, if we look at the current growth rate of deaths in the country, we are expected to double even, our doubling rate is expected to slow down even further. The next doubling is expected only in 18 days.
Right. So it's actually now projected to double every 16 days. So from 15 days, deaths are doubling at every 16 days. And that's the slide that you can see on your screen of how it is slowing down the number of deaths doubling. And is that really the crucial number that is going to, in a sense, redeem India's performance when it comes to fighting the coronavirus? And that, of course, has become the subject of a fairly contentious debate. Thanks very much indeed, Mariam, for joining us. Let me now go to panel. Dr. K. Srinath Reddy is with us, President of the Public Health Foundation of India. We have Dr. S.K. Sareen, who's part of the Delhi government panel, monitor the COVID-19 situation. We have Dr. Om Srivastav, consultant infectious diseases at Jaslok Hospital, and Rukmini Srinivasan, who is a data journalist. Thank you all so much for joining us. Now, Professor Reddy, let me start with you because it is really, I have to say, some of the pieces that you wrote about the focus on deaths, which really provoked us to look more closely at that metric. And it is indeed true as your own analysis has pointed out, that when it comes to deaths per million, India is very low. But Professor Reddy, of course, the big question is whether deaths data is reliable. The assumption is that deaths data is more reliable than testing data, but that is with the assumption that there is no attempt to fudge the deaths and an attempt to mask it. So is there anything that you seem to suggest that is happening, or you believe that the data on deaths is largely reliable?
Srinivasan, let me make a few comments on your various charts.
Yes.
I am happy that you have actually looked at deaths per million, because you have to adjust any statistic according to the population.
Of course.
I wish you had done that even for the cases overall and also case rise per day, because those do not have a denominator of the population. I'll just tell you what difference it makes. If you actually adjust the number of cases per population, India is 108 per million. Iran, which is missing in your chart, is 1615 per million. Peru, also missing in your chart, is 3638, that's 3638 per million. Belgium, which is missing in your chart and is stopping the deaths, is actually 4926 per million. So I think we have to adjust any rate for the population. That's fundamental. As far as deaths are concerned, certainly there could be undercounting, misreporting. I do not deny that. We have actually analyzed only the deaths as reported. However, if we are looking at the trend, the distortions introduced by undercounting are likely to not to be reflected in the trend if that undercounting factor is uniform across a time period. On the other hand, if during a particular time period there is a deliberate attempt to fudge, then of course the counts get distorted. But I would suggest that instead of depending only on the reported deaths, we also need to do a verbal autopsy technique, particularly for the out-of-hospital deaths, and then try and get a much better count, and then get all of them together. So it is important for us to get a grasp of what is happening, but everywhere I would suggest to actually put in the population denominator as well. Otherwise, pure floating numerators can be extremely frightening without context to the size of the population.
No, of course. The reason why we didn't get into that closely into cases per million, as I said, is because cases intrinsically are unreliable, because that's dependent on testing, and that's why the focus largely is on deaths. And you're suggesting that, and I'm trying to simplify it for the viewer, that prima facie, you don't see any large-scale evidence of fudging of death figures. Is that correct?
Well, I do not know. I have not really looked at how the death certificates have been collected, whether they have been accurately reflected, whether. But I would suggest that going by the reported statistics, this is what we are seeing. And it's unlikely that the underreporting or misclassification factor would be so huge as to have such a large differential between India and the United States, or between India and Belgium. On the other hand, we do need to compare states as well, and then try and find out whether there is a differential behavior between the states. And certainly we need to bolster our mortality statistics much better with a variety of sources of data, not just the reported data.
Right. Dr. Sareen, on this subject of kind of suppressing or not accurately counting deaths, Delhi has come in for some criticism that there was an attempt to not fully count deaths due to COVID, which then subsequently has started to happen. Would you say that when it comes to Delhi now, deaths are being accurately counted and there is no fudging of figures, which then brings us back to our point that if that is indeed the case, then when it comes to deaths alone, India is actually doing reasonably well?
Well, I think about the fudging and all that, I wouldn't know much, but I am very clear that there was no fudging. Even the High Court in Delhi said that there was no mishandling of the data. So I think these were things which are beyond comprehension. It doesn't occur. The death is a death. But what I want to tell you, and maybe I slightly disagree with Srinath on that, is that when you look at the number in Turkey versus India, we have almost the same number of deaths and the same number of infections. And in my opinion, the reason mainly is because we have a youngish population. India average age is around 28, 29. Turkey
Right.
is around 30. You take Italy, Italy is around 46. All these European countries have an age which is around, middle age or so. And it is very well known that the death between 20 to 40 is just 0.2% anywhere. It's above 40 that you start increasing, and if it is above 60 or 80, in fact above 80 it is 14%. So the fact we have a youngish population is a point in our favor, and every death matters. Every death matters. So we say we are lower is probably ignoring it. And also a very important fact is, and which probably India has done well, is because our population was in a way BCG vaccinated, and BCG has shown all over. There is a very recent Nature paper that the populations which got BCG have a trained immunity, so the virus comes down and the injury is less. So I think we should carefully look into it, and the population data, as Dr. Srinath says, is when the whole population, when the whole population is involved. That's not there. Our positivity is 5%.
Okay, I was actually going to come to the why of it. Why are we, why is the death rate low in India a little later? But you did address some aspects of that. You're saying younger population, number one, and the whole BCG question. But let me just take that question to you, Dr. Srivastav, that as far as you're concerned, you're, Jaslow, you also perhaps have a kind of an overview of the Bombay hospitals. Are you seeing anything that suggests that deaths are being underreported, like at Jaslok itself? Are you seeing a huge influx of critically ill patients, or it still is manageable, the numbers?
So, two parts to your question. Is it manageable? Well, barely manageable because of a number of reasons. People who are the most deserving tend to get beds, after a fair amount of effort, and not just at any one hospital. I'm talking about across the hospitals where I am attached to, including some of the civic-run hospitals, where beds at this time beds is a problem for a number of reasons. That's probably beyond the scope of this platform. But getting a bed is at this time, it's something we need to prepare for that in a different way. I don't think that the strategy that we are using right now is adequate because of the numbers that we are dealing with, and I'm talking only about the hospitals that I'm attached to.
Sure.
Insofar as underreporting, I don't think so. Look, that would be that this kind of an audit is monitored by multiple agencies at multiple levels. So I would be surprised to say, if you say that these number of people who got infected, of which these number of people who succumbed, that these numbers are underreported. I don't think so. But I'm not the most competent authority to comment on that.
Okay. Rukmini, it's sort of interesting that what we see in terms of anecdotally, we see overcrowded hospitals, we see overcrowded critical care beds, we see dead bodies piled up in mortuaries and increasingly in Mumbai hospitals in the wards itself. But at the same time, overall, the data does suggest that the deaths in India remain low.
Yes, this is the case now, comparatively globally. I'd like to make 2 points. I think one is we can decide whether we want to be looking at the data from a global comparative prism. And sure, it is important for broader trends, but for immediate planning, it might be better just to focus on the numbers as they are right now. And at the hospital level, as the doctor before me just said, it is very difficult, especially in Bombay and in Delhi. The other issue is that I don't think we should talk about this as a pandemic as an epidemic in India that we already know about. It's not in the past. It's very much still growing. So we can say where we stand right now and the things to look out for, but let's not talk about it as something that that has established trends. It's very much growing and growing fast in some areas, growing in new directions, moving to places that have much worse healthcare infrastructure than the places that it began in. All the the newest districts where the largest number of cases are proportionately coming up are districts which have in some cases no ventilators. So let's not talk about it as an epidemic that we know the trajectory of just yet.
Fair enough. Professor Reddy, so let me come to that question which I actually want to take around the panel, which is about why. And we heard some answers from Dr. Sareen. But one thing before that I wanted to ask you, which is again in line with this idea that the critical part, the extreme part of the manifestation of the virus is under control. That if you look at the total number of patients on ICU across the country, that you had, I think we have a figure for that. Yes, Dr. Reddy, it's very low.
It's very low, and the people requiring ventilators are very low.
Do we have a number for that?
Well, I do not have the exact number today, but just a few days ago, the Director General of ICMR said that on that particular day, only 100 patients in India were on ventilator. Most of them others were doing well on oxygen and other measures which did not require ventilator.
150 patients on ventilator across the whole country. That's it. That's actually quite striking.
It was at that time, yes.
Yes, at that time. But I want to ask you about the why. And of course, one argument which the government keeps advancing is because of the lockdown.
Yes,
that is the lockdown which has really contained the deaths. And we've had a series of projections on how many deaths there would have been if there was no lockdown, which included the Boston Consulting Group, whose role is quite fascinating, that they're actually part of this whole process. They projected close to 1.2 lakh deaths if there was no lockdown. Public Health Foundation, correct me if I'm wrong, said there'll be something in the range of 60 to 70,000 deaths if there's no lockdown. Ministry of Statistics of Program Implementation said 54,000 deaths if there's no lockdown. Do we believe these numbers?
Well, you have to go by the number of deaths that have been recorded and the rate of growth, particularly if you're taking an exponential model, and then try and estimate what might have been as the counterfactual if the same rate of exponential growth had continued in the deaths. So that is where the question of savings is concerned. Of course, there are multiple assumptions made and the intervention. But coming to the question that you first asked, what are the reasons that we have a low death rate? I fully agree with Shiv Sareen that our younger population makes a lot of difference. The other reason, I believe, is that we have a much larger rural segment of the population than European, North American, or even China for that matter, those countries. And the mobility of the virus is much less, and even the so-called R0, which is the infectivity factor, is also much less when the mobility is much less. So there are reasons why we have been relatively protected. BCG and others are still speculative, still warrant evidence. We do not know yet.
Okay. No. Well, let's hope that remains an important cushion. The fact that there is this large rural population which is not yet fully exposed, but as Rukmini pointed out, that there is a concern that it is now starting to spread into those states and those areas. But fingers crossed, and let's continue to hope that the fatal dimension of the disease remains low in India. This has been fascinating, but we're completely out of time. We'll have to leave it there. Thank you all so much for joining us on Reality Check. That's all the time we have. Good night.